Hello, Wade Brennan, Principal Physio at Central Physio and Health in Surfers Paradise. This short educational video is to take you through the two types of injuries or the two types of painful events that we see clients have on a daily basis to help your understanding that they are very, very different in presentation and also treatment. The first type of injury is the high or sudden force injury, big impact, big trauma, traumatic event, and the second type of injury is a slow build-up of strain over time with no actually apparent event and lots of pain. So we're going to take you through how they're very different, how the build-up of strain happens over time, just to help you understand how injuries happen. So how are these two types of painful events or injuries different? Firstly, the high or sudden force injuries. So as you can see here, I've made a short list of just how they're different to the slow build-up over time. Firstly, the mechanism is usually very clear with these high or sudden force injuries, i.e. I was on the sporting field and my ankle rolled in a direction it shouldn't have gone. I was at work and I lifted something heavy and I felt something go. So the mechanism is usually very clear. Again, something very specific happened. The client can recall the event very clearly. When we ask, how did this happen? They can give us a very specific story. These usually lead to injuries such as sprains, strains, muscle tears, or even broken bones at time if the force is strong enough. And pain is usually felt very immediately and it's very localized to the tissue that was traumatized in that event. As opposed to the slow build-up of strain over time. I apologize for my video blocking the last one, but I'll take you through it. So with the slow build-up of strain over time, the mechanism is not very clear often. So when we ask the client what happened, some of their common answers are, I just woke up with it, I actually don't know, it just got sore. So it's hard to recall the mechanism. It's also very hard for them to recall a specific event when the pain started. If someone just wakes up with pain, then that pain's been building for quite a long time. Pain can often be fairly non-specific, so the client might describe, oh, it's a bit in my neck, it's a bit in my back, it's in quite a few areas, so it's in multiple areas, and it often fluctuates up and down for no apparent reason. When we get into it, these clients often have a much longer and more detailed story or history of how this is built up over time. When we dig into it, there was often other occurrences or other events in the past, so they're very, very different. Guys, what we have here is a cumulative strain image or graph. We have it on the wall in every treatment room. We take the majority of our clients through this so that you can better understand how pain occurs over time, or if I frame that better, how strain builds up over time until we have pain in our body. So just to preface what we're looking at here, on the left axis, and I'm about to draw on this graph, on the left axis, so over here, we have strain building up over time. So smiley face down the bottom. If we stay with minimal strain in our body, we're happy. If we build up too high, unhappy face, we've crossed the line and we have pain in our body. I've put a dotted line across here. If you stay below the line, you are happy. If you cross the line, you are not happy and you have pain. So let's divide this graph up into two different areas. So on the left-hand side, we've got our high or sudden force injuries, and the blue line is our cumulative strain over time. So again, this dotted line here, if we stay below the line, we're happy. So if we apply this amount of force to our body, we still have a safety zone. So we're happy and we have no pain. However, if we apply this amount of force to our body, we have crossed the line and we have pain in our body. There's your sports injuries, your motor vehicle accidents, lifting something too heavy we shouldn't have done. I fell over on the concrete, my arm hit the ground, my shoulder hit the ground. So those type of injuries are pretty clear to clients. Where we find clients struggle to understand more is these cumulative strain that happens over time. So we're referencing the blue line now. Every single person, myself included, puts strain on our body day after day after day. We go to the gym, we have a hard workout, we recover. We have a bad sleep, we put strain on our body. We sit in the car too long. Eventually, we've crossed the line by putting small amounts of strain, moderate amounts of strain, sometimes large amounts of strain on our body on a daily basis. So what's happened is over time, the strain has built up until we cross the line, and again, now we have pain in our body. No big, large traumatic event took place. This was awkward postures, repeating lots of things, doing things too long, being in the car too long, not moving enough on a daily basis until we crossed the line and we had pain in our body. So hopefully that highlights that yes, you can lift something too heavy or get tackled sideways on the sporting field. However, most people come in with a slow build-up of strain over time. That means the day before you had pain, you were just about to have pain. Maybe even a week before, 6 months before, this was already building up, leading to this event. The flow-on effect, just to finish off this slide, the flow-on effect when we have pain in our body, guys, is before we had pain, we had a certain amount of capacity in our body. Our muscles, our joints, our ligaments, our entire system had a certain amount of capacity, which means it could tolerate a certain amount of stuff thrown at us. When we get pain, our capacity drops. Our muscles, our ligaments, our joints, our tissues are no longer able to cope with the same amount of things thrown at them. What does this mean? You have pain more easily. Now we've got a double whammy. We've got a build-up of pain over time. We cross the line. We've got pain in our body. Now our capacities have dropped. All of a sudden, things that didn't used to hurt us now hurt us very, very easily. So I hope that graph has taken you through that there's very clear differences between the high and sudden force injuries and the cumulative strain over time. Thank you for taking the time to watch this short video. We hope now that it's a little more clear why we see so many patients come in not knowing what's happened to cause this painful event. We hope it's a little bit more clear how strain builds up over time. In the next video, we want to take you through our unique, so Central Physio and Health's unique assessment and treatment process. It's different to what physio school taught us, so we wanted to take you through how it's different, why it's different, and the benefits to you as a client. For more information on this video or to simply ask us questions about what we can do for your pain or your injuries, jump on our website. You can see it there, centralphysiohealth.com. Send us an email at info@centralphysiohealth.com.au or jump on the phone, give us a call, 0756793664. Hope to see you soon.